Aloha friends from Columbia, Maryland. Joe DeMattos here from HFAM, and I am so blessed and honored to be joined by my friend and colleague, Andrea Lev, who's at Signature at Mallard Bay. I admire so much your work. I love what you're doing there. Thank you for the quality care you provide to Marylanders in need in your community. How are you today?
Hey, I'm great. How are you doing?
Really great. You know, we're both runners, so I had a couple of great runs last week. So I still think I'm kind of walking a little on air from those runs.
Fantastic.
Yeah, no, it's great. It's great. You have just under 100 folks in your care right now at Signature Mallard Bay Mallard Bay. I hear from my contacts in the community that you're doing great, and I'm so proud of you. How are things going in the center? How are the residents and patients doing? How's your team holding up as we sort of write the next chapter of fighting COVID-19?
They're doing really well. The residents have really fantastic attitudes. The team has a fantastic attitude. They're feeling really hopeful. The vaccination rates are increasing for both our residents and our staff. And so I think there's sort of a sigh of relief that's happening for a lot of folks.
You know, corporate culture, organizational culture, they're so important. And I'm just so impressed with the work of Joe and Chris, my colleague, Kathy Galen, who I'm on the phone with constantly during the legislative session, and with you leading a frontline team. What would you say has been most important in shaping your cultural quality there at Mallard Bay?
You know, I think organizational culture happens in two ways. It either happens by design or by lack thereof. And I think being really prescriptive and having really strong leadership in our building certainly has helped create the culture that is at Mallard Bay.
You know, the reason I asked you about that, oh, go ahead. I stepped on your line. I apologize.
It's just a strong leadership team. You know, very strong department heads. Very strong education team. So I think all of those things help create a great culture.
And I think, you know, in knowing the way that you operate, it also has to do with having clear expectations on patient-centered quality measures. Yes?
Absolutely. Quality measures and Signature's a 5-star quality measure building. We're very, very proud of that. And certainly expectation about how care is rendered is a big piece of that.
The reason I asked about culture first, and I got to tell the listeners, I didn't warn you about that in advance. So that was completely off the top of your head, and you were so authentic in it. But the reason I asked you about culture is I do want to speak today, and we're talking today about increasing vaccination uptake in our sector. You've been pretty successful in vaccination uptake. Without getting into the stats, let's talk about how you rolled out vaccination in your center. What were some of the steps that you took to really lead in vaccination uptake?
You know, we made a really strong effort from a leadership team perspective. Certainly the leadership team went first when it came to volunteering for the vaccination. Our clinic was actually in January, the beginning of January. We called and contacted every family. We spoke to every resident regarding the vaccine. We also spoke to every staff member. For any staff or resident family that was hesitant to getting the vaccine, we involved our medical director, we involved our nurse practitioner. There was a lot of peer-to-peer discussion, but we literally spoke to everyone to enthusiastically encourage them to get the vaccine, to try to waylay any concerns. And just the freedom that will come and the hopefulness that comes from getting the residents and the team here vaccinated.
So Andy, what I'm hearing is that you had a plan, and at the core of that plan was communication. I mean, you literally spoke to every family, every resident, every employee. You made your medical director available, your nurse practitioner available, and you still had peer-to-peer conversations, and you had a plan for all of that?
Absolutely. Certainly after the first clinic, you know, there was a lot of those folks who said, well, after everybody else goes first, then we'll go. And so we saw people who after the first clinic sat down again with the medical director, sat down again with us, talked to their peers about, did it hurt? What did you feel like afterwards? Any side effects that they experienced. But I think really just being open and transparent was a big piece. And certainly we had residents, families who after the first round even agreed to have their residents be vaccinated.
That's great. So from a professional perspective, as a healthcare leader, providing quality care to Marylanders in need in your community, why is the vaccination important? I mean, I know it seems like a stupid question, but why is it so important, vaccination in your center?
I will tell you, we had a COVID experience here in October, and it was a rough one, honestly. So when the vaccine became available in January, we were thrilled that we could offer that to provide that for our residents and staff. And recently, just a couple weeks back, 2 weeks back, we had 3 staff members who were unvaccinated test positive again, and literally have been testing residents and staff in this final 2-week period. And not another single resident or staff has tested positive. And
Whoa.
That right there speaks to the amazing part that the vaccine can do. And, administrators across our industry are on pins and needles waiting for those PCRs to come back. And the vaccine has certainly provided a sigh of relief to us in that way.
Well, that's a testament to really, I think, 4 things. It's a testament to your leadership. It's a testament to the team. It's a testament to your infectious disease protocols, doffing, and all of that. And it's an endorsement, a testament to the vaccine and the importance of the vaccine. Let me ask you this one final question. In the end, healthcare is a people helping people enterprise. No matter how you're organized, for-profit, nonprofit, big, small, doctor's office.
Sure.
It's quality, medically trained professionals, people taking care of people. And on some level of degree, we all have friends and family, and we're all people. So just as a person, why is the vaccine important to you as Andrea Lev, the person?
COVID year was really difficult for everyone, right? So for me, I'm going to get on a plane and take my children on vacation to Florida in the beginning of June. So for me, it's being able to have a little bit more freedom to feel a little bit more confident that as a healthcare worker, now in my 29th year, I may not be coming home and introducing my family to something that there's a vaccine for. So there's a freedom that goes with that I think is again a sigh of relief.
So if you had to say one message to your colleague administrators and the teams from maintenance and groundskeeping to doctors to GNAs to nurses, just the whole crew of healthcare heroes, if you had to tell them one thing about vaccination, what would that be?
The first thing I would say to them first is thank you. Thank you for all you're doing and for the care you're providing and for the dedication. And then the second thing would be is go first. Be the leadership team, because when you go first, you will see that your vaccination rates will be higher across the industry. When leadership has agreed to the vaccine and has shown their team that they believe in the vaccine, vaccination rates have been higher. So be leadership, go first.
Andrea Lev at Signature at Mallard Bay. I think you've taken that social work degree to levels that your instructors never really thought you would. Maybe some hoped you would, but you've been a connector, a navigator, a person that puts value and people at the heart of all you do. And I just want to thank you. I look forward to this time later this year when I can get back into your center and other centers. Pre-COVID, I was in the center every 2 weeks. And what I really miss is being able to look into the eyes of you and your team, your residents and patients in person. And, I've been in this part of the country for almost 20 years now, but I'll never stop saying aloha to people and sharing with them the love and appreciation that I have for them. So I genuinely thank you for all that you do. Please, 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 please stay safe. Thank your team for all of us, and have a great May and a great vacation in June. Thanks for making the time.
Sounds great. Good to see you. See you out running.
I'll see you out running.